A very good evening, ladies and gentlemen. I'm your host, Dr. Aditi Nanda. I cordially invite you all on the behalf of Dentist Channel to today's webinar. Thank you for joining with us today. But before we begin, it's a pleasure to welcome our distinguished guest speaker, Dr. Navdeep Kaur Walia. She's an all-rounder, a public health dentist, a successful practitioner, an eminent speaker, and a guide to many, including myself. With more than 12 years of an impeccable academic career, she has the same passion and determination as she must have had in the beginning. Her students and her colleagues have seen her hit milestone after milestone during her journey. She has conducted innumerable dental camps and awareness campaigns. And here she is with us to impart her valuable knowledge to us today. Ladies and gentlemen, Dr. Navdeep Kaur Walia. We warmly welcome you, ma'am, and thank you for joining with us today.
Good evening to all of you, and thank you, Aditi, for the kind introduction. I'm really grateful.
Thank you, ma'am. Ma'am, before we begin, we would like you to shed some light on what all are we going to learn today.
Okay, so we are going to first talk about India as a democratic nation, what we stand for, what are our values and everything. Then we would just go dive in a bit of statistics, that what is the dentist as to population ratio in India today, what are the core problems, and what are the post-COVID scenarios regarding.
That definitely sounds interesting, ma'am. Also, to make sure we are helping our audience as best as we can, we have a Q&A box given below. You can feel free to put up your queries, and all your queries will be addressed in the end. So without further ado, let's get started. Ma'am, you may share your screen now.
So is the screen, Aditi, can we, are we sharing the screen?
Ma'am, you can share your screen.
Yeah, I'm doing that. Is the screen sharing done?
No, ma'am, not yet.
So you can share the presentation which I've shared with you.
Yes, ma'am, I will. Ma'am, you instruct me and I'll move the slides further.
Right. That's
right.
fine.
Okay. I hope my screen is visible, ma'am.
Yeah.
Okay.
So good evening, one and all. I am Dr. Navdeep. As Aditi has been too kind to introduce me to all of you, I would put up my views of dental public health and all what I know and share. So let's see how much people benefit, and then you can ask me problems in the end of the session. So let's go ahead, Aditi.
Yes,
First of all, let's talk about India in general. We all know that we are a rich cultural diversity with so many states, 28 to be precise, 8 union territories. Yes, let's go beyond. So we have to first understand that how did dentistry in India start? So the Indian medicine to start with was based on the notion that the 700 vessels of the human body carry, in addition to the blood and the 3 basic doshas, which they put up as pitta, the bile, the kapha, and the most capricious, that is the vayu or the wind. So the first pioneer was Sushruta, who taught dentistry, which was scientifically done in Varanasi in the 600 BC. And he's universally acknowledged as the first dental anatomist of the world, known as the father of surgery, also known as the father of plastic surgery and cosmetic surgery. He taught surgical skills to his students on various experimental modules. For instance, incision on the vegetables, like one which we can see here. Apart from this, mandibular reductions were done during that time. So these are some of the dental instruments which were used back then. Then came the Buddha period, which saw a setback in the dental surgery because the teachings of Lord Buddha prohibited the dissection of the human body. So the touching of dead body or flesh was considered unholy. So after this, the Mughal period, the period of the Guptas, there was all a dentistry setback basically till the British era. Yes, we can go ahead. Which was in the 19th century, where the medical education based on modern system of medicine was started by the East India Company. So around 1920, a course in dentistry was introduced for the first time and one of the subjects of study for medical students at the Calcutta Medical College. So we can move ahead. So we credit all of this to Dr. Rafiuddin Ahmed, who is rightfully called the father of dentistry in India, who started the first dental college in 1920. The next slide, which is called as, we can just have the picture of the college, which is in Calcutta, earlier called Calcutta. So the institution offered a diploma to start within dental sciences upon successful completion of a 2-year program. In 1926, the duration of the institution's program was increased, which later in 1935, the Bachelor of Dental Surgery, that is the 4-year program, finally started. So in 1947, the Indian Dental Association was founded, and before independence, in 1947, before that, there were only 2 government institutions, one at Lahore and the other at Bombay. So the Dental Council of India was established in 1948. So it is the body under an Act of Parliament, and DCI is the premier governing body of dental education in India. So as we all know, its responsibilities include the regulation of dental education, profession, ethics, the government to obtain the administrative approval for dental colleges and higher educational courses. Now, let us just go in a little bit of statistics of India. We all know that India is 64% rural and only 36%. Sorry, just go ahead. Okay, first let's understand the 36% is the urban and the place is the rural, where we understand that 943 females per 1,000 males are there. Yes. And this is a just brief estimate of deaths which are caused by, in the year 2005, the statistics was laid down, which was majorly shifted over in the post-COVID scenario. Let's go ahead. Now, population of India has been on a rise, and we are the second most thickly populated country in the world, 7th in on the basis of the land area covered, but only 2nd on the basis of population. And 138 crores we recorded in 2020, which is now exceeding with every passing second. Now let's understand that there are 2.7 lakh dentists in India, according to the 21st April 2019 statistics. So out of over 2.7 lakh dentists that registered with the Dental Council of India, the government employees are only 7,239. So we all can understand that only 5% of the dentists in the whole nation, in our country, go and get government jobs. So let's go further, just for a refresher. Now, what is exactly dental public health? We all know dental public health is an art and science of controlling and preventing diseases, and then giving various programs for control of further dental problems. So this functions, yes, we can just go back, Aditi. This functions basically by servicing to the community, that is education through dental research, administration, prevention, and control. So dental diseases are actually on a community basis here. And the study of the population is the criteria rather than an individual as such. So it is basically community based. The dentist population ratio in India is 1:30,000 according to the WHO 2014 statistics. As of now, the urban population, it is 1:10,000 and the rural is 1:1.5 lakhs. So we can clearly understand that there is a lot of discrepancy between the urban and the rural areas, but still we understand that the rural areas are more in wise of the population than the urban, but most of the dentists are concentrated in the urban population. So now we are going to understand that why do we need to collect and use all this statistics for? Why are we talking all this? So vital statistics, as we know, we've all seen in the COVID times that every morning we used to wake up and just read the paper and see the statistics. So the alarming statistics would make us know the severity and the gravity of the situation we were in. Then the information on the reportable disease like COVID-19 and the registries of the other diseases, the communicable and the non-communicable diseases, so that we can all come plan, program, and take action for these diseases. As a result, we could have an administrative data collection on which we could work. So these are the COVID statistics. We have to yet, really prove that these statistics are correct or not. But there were 4.46 crore cases of COVID-19 which were registered, but they are still questionable. And then there was 5.29 lakh deaths in the country which were registered. So now we are coming to the core problems of the public health, the dental public health as such. The workforce of the dentists in 1970 were 8,000 dentists. And in 2010, there were 30,570 dental graduates, which is now increasing as of the registries. And the job opportunities are variably less. Like there is a lack of government jobs and only 5% of the dentists get government jobs. So a more problem to all of this scenario, current scenario, is the irregular distribution of colleges. Now, as we see statistics, there are such less number of dental colleges and the number of private colleges are much higher. And then the postgraduate seats in the colleges in the government sector is further less. So as a result, we know that so many dentists, so many dental students are looking for courses abroad. And then they are drifting from dentistry. They are going into other courses away from dentistry. And very less people want to do private practices in India. Maybe because of the infrastructure, the expensive methods in practices which are being used, or there is a problem of growth which they see. So there is a lot of scope for dental public health. We are going to just talk about little things moving ahead. First of all, in the basic research, for the knowledge of all the students who are in their final year, they can start with some ICMR projects, which under the UG programs is the STS programs. So if you just go to the website of ICMR, you check that there are 2 programs, which by the time they start, there's a deadline for January to the March end, and then you can program into this STS programs, where you can do some basic researches, and then furthermore, you can do some clinical researches also. And then there are so many workshops which are available in this for statistics, which are also there. So if you just see workshops for biostatistics and free workshops available, you can always gain your knowledge with it. Yes, Aditi. So dental public health can be a dental public health dentist, as we put up. So there are a lot of options under that. First of all, there are a lot of NGO programs which can be done in the public health scenario. Then we can do PhD, that is the doctorate, with the MPH, the MSCs. So the MPH programs are going to be in the hospital administration, and they are going to be in the research administration programs. Then there can be the epidemiologist, where you go with the statistics, that is the biostatistics and the epidemiologist. Then the health management, hospital administration, where you have the MPH programs also. Then the public health activist under the NGO programs and with various societies which can be joined in. So these are just some of the options which I've put up. So under the essential public health services, there is to start with the assessment, where you assess the oral health to start with. So if you remember your phases of public health to start with, so there can be the assessment where you assess the oral health, you analyze the determinants, that is including the resources, you assess the resources for the fluoridation programs, then you implement the oral health through surveillance systems under that. Then comes the policy development. So based on your assessment, you furthermore have the policy development and then assurance for the work to be done. So just go back, Aditi. Let's just understand this in accordance with the COVID scenario. So when we have had this COVID-19, we started to first of all assess the status of the COVID-19 in the general population. So the oral health status, not the oral health for the COVID-19 only, the general health status was also assessed. And as you could see that there were so many epidemiologists who were working on it night and day, and still furthermore, so many studies in retrospect are going on to assess it. Then based on that, further we would have policy development and assurances based on all what has passed through. So we have a full detail of the courses abroad and so many things which are going on. Students come and keep on asking. So it is like a lengthy seminar as such, if we talk about the other courses which we take and what options are open to the students.
Definitely, right. Thank you so much, ma'am. That was one such knowledgeable time with you. And every bit of information was backed up by facts and numbers. And we truly appreciate the length you went to make us understand the dental public health, this Indian scenario. Ma'am, there are a couple questions.
All right.
Ma'am, as you just mentioned that like the epidemiologists, they work so hard, they collect the data, they suggest the policies. Do you think that at the ground level, the implementation is up to the mark? Like, where do we still lack?
See, I would just take an example of the policy making which is taking place. So as you would have heard about the curriculum change, that the dental curriculum is going to be changed. So the government is working to it. We see there are some changes, like they are now thinking of dental education to be, core based. There are going to be other important topics which are going to be added, like forensic odontology, for example. They want to add that, and then they want to add other core topics which they think are important. So this is just an example of the curriculum. The policy development example is the no tobacco centers. They are putting up policies for people to not use tobacco in public. Now, the policy development is one aspect and the implementation is the other. So we all know that when we put up implementation in some things, there are a number of other factors which take place. But I would say that change is taking place. That when we go to an institute, there are completely campuses where it is written that it's a no tobacco zone. And if you smoke, it is not allowed and it is punishable under the law. So it is one such example of policy development, right?
Right. Thank you, ma'am. Ma'am, and there is this another thing, like many of us talk about the dental treatments to be covered under insurance. What is your point on this? Do you think it's feasible for the Indian population, like for the Indian natives?
Yes, as we of my all these years of practicing dentistry and holding camps, I can see that oral health is the most neglected part. When we
Definitely.
know that oral health is an essential part of journal health, we know that we talk about it all the time, but people still do not want to, take any steps. When they are in the prevention phase, they take oral health very lightly. They actually work for it when it comes in the pain stage and when the patient cannot hold it any further. So why is that so? Because we've already talked about the statistics of the population, the rural and the urban. And then when we talk about the money and the income of the people, that would further be, increasing the burden of the oral health diseases on the people. So if we have dental insurances available by the government, that is one step which the government should be taking, because under that only, if we just cover the oral prophylaxis and restorations under the insurances to start with, the people are going to get benefit from it for sure.
We can stop the disease at the early stage.
Yes. So like we talked about the levels of prevention. So if we can hold it at the, the first level of prevention where we can take steps to prevent it is the best. But if also at the second level of prevention, that when the just the disease has started and we take actions, it will also decrease the burden of the disease.
Thank you, ma'am. Ma'am, and what's the post-COVID scenario? Like, are patients coming in equal numbers post-COVID, or have they got an excuse like, there is COVID going on, we should not get the treatments done, or something like that?
Yes. So post-COVID scenario, we have a number of other diseases also. So we have a increase in the swine flu cases, which is coming now. And then in the children, in the primary age children, we see the hand, foot and mouth diseases, where the role of the dentist is again, has increased, because children are having those ulcers which they cannot identify. So it is the role of the parent, the teacher, and then the dentist to check for those lesions in the mouth. And then post COVID, the immunity is furthermore hampered, which we can see. And then people are getting a number of other relatable infections, and stress is a trigger risk factor with all of this.
Like, so post-COVID, it is now even more important to get yourself checked.
Yes, it is. And health education plays a premier role. So all of us, hold the foundation for that we have to give more health education to the general masses to get themselves screened, get themselves checked, and watch out for any kind of oral disease they have.
Right, ma'am. We are very grateful to public health dentists like you who are, working day and night to make this possible.
So I'm just humble that I got the platform to talk about, and everybody is most welcome to ask for any queries, any other questions.
Ma'am, there is one more. You mentioned about MScs and PhDs. What are the subjects that a person can do masters in?
So we can take doctorates in subjects of their own liking. Like, for example, if you have a new research in your mind and you want to start with it, but you have to see like-minded people with your guides and your professor team. So till the time when you have done your MDS, so you already know of the topics which you are more better in. Like, for example, like biomedical waste is one which I have been studying so far. So we can talk about things furthermore from here to take a topic of research which would be new and which would be helping in some way, and then we can go in further with it.
Ma'am, also you shared the scenario, like students are definitely moving abroad. We see it like with every batch. So is it the right thing on their part? Like, do they have an excuse for it?
Just share my opinion. So I know of the people, so many students we know that from our dental college are also moving out all the time. So what do they do is for 2 years, they have to take some diploma program, right? To do furthermore. Now they want to do something which their friend is doing, which they are not interested in, and which they would not do after they get their PR.
Right.
So for me to hear all that is just like wasting time. But if you do a little bit of research on all of it and you do something which will benefit you further on, then it would not waste your time. Then going and wasting is not one point. You will invest in money, you will do for your further education, and that would help in your DDS too. So you should change or take a topic which you like and which you have your mind in. So we have so many students coming and asking for MPH. So if they have that aptitude, they can surely do that.
Right. Thank you so much, ma'am, for your words of wisdom.
No, you're most welcome. And I
Yes.
hope that it was any benefit to the people.
It definitely was, ma'am. Our students must have had multiple takeaways from this. Ma'am, before we wind up, I have a little presentation to give our audience a gist of Dentist Channel. May I?
Yeah, sure. Please.
DentistChannel.Online is the first digital dental media in India, and we stand strong with our motto, healthy smiles, wealthy lives. We offer multiple services for all the eras of fraternity, from dental professionals, dental students, dental organizations, and dental businessmen as well. I feel proud to share that we have conducted over 700 plus live webinars with 40,000 beyond participants. There have been 25 workshops and still counting, and we have invited over 400 plus national and international speakers on our platform. Another major milestone was hit by us. We were awarded the certificate by India Book of World Records for maximum speaker participation in any virtual dental program on oral implantology. To our Prime members, we offer the certificate of participation for each of our webinars, and each certificate contains one CPD point. We will welcome you on our upcoming webinars by Dr. Dala Savas and Mausami Iqbal. And we would love your engagement over various social media platforms like Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, and Twitter. Thank you so much. We had a wonderful time and hope that this webinar was useful for you. Thank you so much, ma'am. Thank you so much for joining us. It was a pleasure hearing from you.
It was a pleasure being part of the show. Thank you.
Thank you so much, ma'am. Good day.